Imagine a water hose in your garden. When the hose is clear, water flows easily. But if the opening gets narrower, the pressure builds up, straining the hose. This is exactly what happens inside your body when you have high blood pressure, except the hose is your blood vessels, and the pressure is slowly wearing down your heart, brain, kidneys, and arteries. High blood pressure affects people of all ages, but it's especially dangerous because most people don't feel it happening. In this video, we'll break down the real reasons behind hypertension so you can protect your health before it's too late. Blood pressure measures the force of blood pushing against your artery walls. Two numbers make up the reading: systolic pressure when the heart contracts and diastolic pressure when it rests. Healthy numbers are around 120/80 millimeters of mercury. If your reading is consistently 130/80 millimeters of mercury or higher, you have high blood pressure. But the numbers alone don't tell the story. They are the result of deeper ongoing processes inside your body. The most common cause is narrowing and stiffening of arteries, often due to plaque buildup. This condition, called atherosclerosis, reduces the space for blood to flow, forcing your heart to pump harder. Over time, this constant strain raises pressure and damages the vessel walls. Poor eating habits, smoking, lack of exercise, and chronic inflammation are major contributors. Sodium found in salt is a big player in high blood pressure. When there's too much sodium in your diet, your body retains extra water. That extra fluid increases blood volume, which raises pressure inside your vessels. Many people blame the salt shaker, but most sodium actually comes from packaged snacks, fast food, processed meats, breads, and sauces. Cutting back on these sources can quickly lower your blood pressure. Stress triggers a surge of hormones like adrenaline and cortisol. These hormones increase heart rate and tighten blood vessels, a perfect recipe for raising blood pressure. While the effect is temporary during a stressful moment, living in a constant state of tension keeps your blood pressure higher than normal. Over months and years, that damage adds up. Extra weight means extra work for your heart. More tissue requires more oxygen, which means your heart must pump more blood. This increased workload pushes blood pressure higher. Obesity also increases the risk of type 2 diabetes and kidney issues, which can further raise pressure. Even modest weight loss can lead to meaningful improvements. Some people are genetically more likely to develop hypertension because their bodies process sodium differently or because their blood vessels are less elastic. The kidneys are also key regulators of blood pressure. If they can't properly balance fluids or produce the right hormones, pressure can rise. And once high blood pressure damages the kidneys, it becomes even harder to control. Drinking too much alcohol, smoking, and excessive caffeine can all raise blood pressure. Alcohol can damage the heart and add excess weight. Smoking tightens blood vessels and harms their lining, making them less flexible. While caffeine affects people differently in sensitive individuals, it can cause noticeable spikes. Your heart is like any muscle; it needs regular exercise to stay strong. A strong heart pumps blood more easily, lowering the pressure inside arteries. Physical inactivity leads to a weaker heart and less flexible vessels, both of which contribute to hypertension. Sleep is when your body resets and heals. Poor sleep quality or conditions like sleep apnea increase stress hormones and disrupt your body's ability to regulate blood pressure. Treating sleep disorders and aiming for deep, consistent rest is essential for heart health. As we age, arteries naturally lose elasticity, making it harder for blood to move freely. In some cases, high blood pressure is secondary caused by another condition, like thyroid problems, adrenal gland disorders, or certain medications. In these cases, addressing the underlying problem can fix the blood pressure issue. Once blood pressure rises, it often creates a damaging loop. High pressure damages blood vessels, making them stiffer and narrower, which further raises pressure. This can lead to serious complications like stroke, heart attack, kidney failure, and vision loss. The earlier you take action, the better your chances of breaking this cycle. High blood pressure is often preventable and, in many cases, reversible. A diet rich in fresh fruits, vegetables, whole grains, lean proteins, and low in processed foods can make a big difference. Regular physical activity, stress management, avoiding tobacco, limiting alcohol, and monitoring your blood pressure at home all play important roles. High blood pressure develops over time, but so does good health. Every positive change you make, from eating better to moving more, lowers your risk. Don't wait until symptoms appear, because by then the damage might already be happening. Start small, stay consistent, and protect your heart for life.